Later analysis of the WHI study also revealed a very important factor. The factor was the age of the participants. The average age of the participants in the study was 63, whereas the age of menopause, average age, is 51. The potential for this factor alone can skew the results. Older individuals are already at risk for these diseases, and they already have long-standing inflammation predisposing them to heart disease, predisposing them to cancer. This observation led to conclusion that there is this healthy cell or the timing hypothesis. So when you start perimenopause or you enter menopause in 40s to 50s, your cells are still healthy. There is no time lag between your estrogen depletion and the initiation of therapy. So your cells are still responding well to the hormone replacement. Versus if you're 10 years post-menopause, some degeneration of the cells and the DNA and inflammation has already happened. This theory tells us that there is a critical therapeutic window. This critical therapeutic window is the time frame where we have the best impact or the best outcome possible for prevention of cardiovascular disease, prevention of osteoporosis, prevention of neurodegenerative diseases like dementia, prevention of osteoporosis and bone fractures. One of my favorite lines from the book is that, in general, the healthy cell hypothesis leads to the theory that estrogen is better at keeping a cell in a healthy state, and that the lack of estrogen leads to a cell being unhealthier, suggesting that estrogen may be better at prevention rather than cure. One important thing to consider from the study is also that a subset of women aged 50 to 59, the risk of myocardial infarction, the heart attacks, in those using estrogen therapy was 40% lower than the risk among those who received placebo. On the other hand, hormonal therapy initiated by women 10 or more years post-menopause was associated with slight but not statistically significant increased risk of cardiovascular disease. What we can conclude from this is that the estrogen is better at preventing coronary artery disease than at stopping it once it has started. Once the process of atherosclerosis and plaque formation has started, then it's too late. American Heart Association in 2020 released a statement that the menopausal transition is more of a factor than aging in initiating increase in lipids, metabolic syndrome, risk, and vascular remodeling. A statement issued by American Heart Association in 2020 said that the menopausal transition is more of a factor than aging in initiating increase in lipids, metabolic syndrome risk, and vascular remodeling. This is not the good kind of remodeling. It's the remodeling that actually predisposes you to heart disease.